say we're here at the hospital. We made it. Since we're tucked out of the main waiting room, I thought I'd hop on. We drove an hour, and I gotta fix my hair. I should say welcome to my day. Hi. We are at the hospital for Miles to get his Baclofen pump put in, which requires surgery, right? We talked about that. You're just upset I paused your music. But we drove an hour, and his diaper was wet, so I asked him where, because we didn't get checked in yet completely, and I asked him where I could change him. And of course he doesn't fit on a baby changing table in the bathroom, so they said I could use the little couch in the consult room. And Miles is 15 and probably almost 5 foot. Anyways, I'll show you a picture. All right, we saw the neurosurgeon and we saw anesthesia. Yeah, and you're dancing and hanging out. What do you think? We're gonna go back soon. Oh, our nurse is gonna come in. We're getting the Baclofen pump put in. We're gonna put a pump in his abdomen, and the catheter will go around into his spine. Whoops, sorry. And then that will deliver the Baclofen to where it needs to go in a much smaller dose, right? So we'll check in after. Yeah. So you're so chill. You're so chill. See, God's got us, right? We're laughing about mustaches. His mustache. Daddy.
Can you see your peach fuzz mustache?
Daddy wants to give him a mustache. Do you see his mustache?
He wants a mustache.
You want a mustache, Miles? What does everyone think? Should we grow a mustache? Yeah. So funny. I guess we should say, if we've never had surgery before, you come in here and you check in with the nurse. Registration checks you in, gets your height and weight, and blood pressure and temperature, and then you change. And we wiped him down with some sort of wipes.
Prevents bacterial growth.
Prevents bacterial growth.
Antimicrobial, antibacterial.
Yep.
Wipes.
And then the surgeon comes in and talks to you about the procedure, asks if you have any questions, and then the nurse asks about medications, when you ate last, all the things you've had, and what else? Then the anesthesiologist comes in and tells you what they're doing, and asks you if any questions. I loved how they all made really good eye contact.
Why are you filming me?
Because I don't want to film myself. Then you can add your information.
What about do unto others? My goodness.
Because you're never in the videos.
Well, I am now.
And then the OR nurse will come in and talk to us. Mm-hmm. And then we're good to go. They're prepping the operating room now. And he's gonna go back. And he'll be awake just for a minute, and then they'll put him under. And then after they put him under with the mask, then they'll do the IV. And if they need to do something for breathing. Breathing tube?
Yeah, they'll intubate. But that'll be in and out all while he's
asleep. Yeah.
At no point when he's awake.
So he won't get poked or anything while he's awake.
You have to take a nap and you'll wake up groggy and we'll be there again.
Beep beep, yeah. All right, so that's what's happened here. And then so they'll take him back from here and we'll go get breakfast or hang out or whatever. And it'll take...
It's all said and done about 3 hours.
3
Operation's
hours.
usually hour and a half. And time back there prepping and wrapping up.
Yep. I'm making a video because I feel like there wasn't any videos that really explained it very well.
Oh.
What you go through when getting the pump put in.
Yeah.
So I wanted to do a step-by-step. This is what to expect.
We talk about how it's under the skin and wrapped. I mean, doctors explain that.
Yeah.
Yeah.
I think I'll do a video after the surgery to show a little bit more about what it is.
Yeah.
But yeah. Okay. I did explain that 2 days ago or something. I did a little video while he was sleeping. Oh, no, no. That was about nursing. Oh, my goodness. I have too many things I'm meeting. We have too many new things happening right now. Don't we? Why is your tongue out? Boop, boop. Boop, boop, boop. You're funny. Okay, long enough. Say bye. Goodbye. And while you're waiting, while he's in surgery, you can go get snacks. We have comfort food today. But we gotta find a little courtyard with flowers at this hospital. We explored around. It's a beautiful day outside, and I like to be outside because it's refreshing to my soul. So, it's 3 hours. We're gonna eat lunch and then go back up to the waiting room, I guess. Trying to wake up. Miles likes to sleep a long time. Coming out of anesthesia. He keeps going in and out. You sleepy boy. He got his IV in. They said once they go under anesthesia, your veins open up, so it's easier to get your IV in once you're asleep. Okay, we've moved from the recovery place, post-op or whatever room, and now we're in a more private room, and they're gonna check his neuro status every 2 hours, which basically means we check his pupils if they respond to light. They were a little slow at the last check, but he's been snoozing, but I finally got something to wake him up here. Yeah, your throat sounds like it's a little dry from the airway they did for you. So apparently we're just here for 24 hours, hopefully, instead of 3 days that I packed for. Yeah, so I thought that the one doctor told me that most kiddos are in for 2 to 5 days after the pump surgery. So then they're telling me now that it's just overnight because he has to lay flat for 24 hours. So I don't know. I packed for like 3 days. So I have this big old suitcase Dave is bringing in for me. So I don't know. We'll see what happens. I guess it's better to go home sooner than later. That means everything's going well. So yeah. We have a nice view out the window. I opened the curtains because he was snoozing hard. And I feel like I know he just had surgery and sleep is good for recovery. But I don't want him to be up all night too. Miles is good at getting his nights and days mixed up if he naps too much. So I got him to watch Blue's Clues and now he's awake. Anyways, so yeah. What else? So yeah, they're checking his vitals. They wanted him to wake up so they could check his eyes and make sure he's responding well to everything. So it's a simple room. It has a TV, has a closet, and a sink. Oh dear, that doesn't. He's fine. He was just laughing. Apparently he has some lingering something from his whatever had from surgery. He was okay. Right, so you have to lay flat for at least 24 hours. So he's allowed to sit up. It has to be under 30 degrees. That's as high as he's allowed to go. So to eat, right? So about like that. So we're trying some soft things in case he doesn't chew enough. It'll go down easier, right? You got a wonky bib on, but he's doing well. He's happy, right? You still have your IV in, but they took you off the monitors. You doing good, Miles? Can you flash me a smile for the YouTube video? No? You're waiting for your next show. I see. Okay. All right, so I'm going to hop on quick. And I realized that in my video, I never really explained what the pump was. And I'm about to have the doctor's videos come on talking about the pump. So Miles receives Baclofen. He did receive Baclofen by mouth 3 times a day. Baclofen is a drug that helps decrease the tone. So his muscles were really tight before we started Baclofen, and like his legs would cross, and it would be super hard to like change his clothes and change his brief, his diaper, and you know, he's so tight, his arms, it would be hard to move his arms, and so the Baclofen relaxes that. I don't know if I'm saying all the scientific stuff, but anyways, he was getting that medication compounded, so it wasn't in a liquid form when we started, and so it would have to go to a special pharmacy that would turn it into a liquid, and he would get 5 milliliters of that 3 times a day, so morning, afternoon, and night, to keep it working in his body. And as he would get tighter, I said, oh, I think he had a growth spurt where you might need to increase, so we'd always increase. So all that being said, there's something called a Baclofen pump where I'll put a picture of it in. It's like the size of a hockey puck, and they put it in your abdomen, and it's full of the medication, and instead of getting the 5 milliliters a day, the 15 milliliters a day, it will, the pump filled of medicine is attached to a catheter that goes around from his abdomen back into his spine, and it goes up through his spine, and then it connects and deposits the medicine into the spinal cord to make it disperse to his arms and his legs better. We took at least 2 years and lots of questions and research before we decided to put it in. There are risks involved, which the doctor, you'll hear her talk about. But it will help decrease his tone. He'll get a much smaller volume of medication, and it will do a better job, because taking it by mouth, it disperses, it has to go through your digestive tract and all the things before it actually works. And so you have to take a lot more for it to actually be effective. This, it's getting exactly to where it needs to go. And so instead of taking 15 milliliters a day, he's getting like 75 micrograms or something really super small. And then as his tone is decreased, hopefully he can start to build muscle and maybe actually use his body more efficiently to do things, sit up, or I don't know, move his arms or hold something. I don't know, hopefully something, but that's going to be something we figure out later. So the catheter connects to the pump that's in his abdomen and goes around to his spine. I will put 2 pictures on, and then you can hear from the doctor. Okay, so today is Thursday. He had his surgery yesterday on Wednesday, and this morning early neurosurgery came in to check on him. They checked his incisions. We talked a bit, and he should be good to go home today. He took off the bandages over the incisions, and it looks good. They had used a paste or glue or something for the incisions, so that will dry up and flake off when it's done. I'm really glad it's not stitches or staples, which is awesome. It's a little different. I don't think I've seen the glue yet. I think I had staples on my C-section. Anyways, so he can sit up when he needs to sit up, but probably stay flat as much as possible in the next couple days. But he can sit up to go home and to eat and stuff. We can shower him, but not immerse him, so no swimming or baths, but we usually shower anyway, so it'll be alright. for at least 2 weeks until the incision is healed. So I think our follow-up appointment is in 3 weeks. So they'll check then and give us the go-ahead. And then I'll have to show you the incision. So he has one incision in the front and one on his back. Right now he's watching his show, so I don't want to bother him. And then the rehab doctor came in to check him, and she showed me how the pump works. I mean, she brought the computer in, and so she could check some things and connect them together with her iPad thing. And then she also used the remote to show me what the alarms sound like when the medicine gets low. So I might put that video on here. I'll have to see what Dave thinks. So when there's a critical error or the pump's about to die or the medicine's about to be bone dry, there's an alarm that goes off. And then there's also one that goes off that sounds different if it's like, hey, you got a couple weeks and then you need to get it filled. So they're kind of faint though, so hopefully we'll hear them. But there'll be a nurse now, so it'll be easier to have backup for that. Yeah, so he's having fun right now.
So obviously, now that the medicine's going into his spinal fluid, the risk of overdose and withdrawal is higher, right? Because it's going right into his spinal fluid. That being said, the risk of overdose is almost always related to an error, like a human error, like me putting a higher concentration of medicine in and not realizing it, or like some medical error, medical mistake. There's not really a mechanism for accidental overdose via the pump. It's almost always a provider making a mistake. And I will say I have made a mistake one time that I caught when I reprogrammed the pump. So it didn't actually get to the patient, but I did put a different concentration of medication in than I thought I was putting in. So it can happen.
Okay.
So signs of overdose or excessive sleepiness, excessive low tone, like right, he's like totally loose, slow breathing, low heart rate. Again, that's going to be a medical emergency and you want to come to the hospital, and we'll probably turn the pump all the way down to the lowest setting until he wakes up again.
Okay.
The other time that there's a risk of overdose is if there's a pump malfunction and we replace the pump. And so we weren't sure how much medicine he was getting before.
Oh, okay.
And so if we miscalculate how much he needs currently, then when he comes out of the operating room, he could have an overdose because there's a mismatch from what he was actually getting versus what we thought he was getting, and then what we programmed the pump to. So those are the two kind of scenarios where we can see overdose. If there's a situation where we're replacing the pump because we're concerned for a malfunction, I will kind of let you know the risk of overdose and we can decide. So some families will decide, well, you know what, overdose is really scary. I would rather just put the pump on the lowest setting possible and then see what he's like when he comes out of surgery. And then, yes, he might be a little bit withdrawal-y, but we can use other meds and we can increase the pump. Some families are like, no, withdrawal is terrible. I don't want them to be in withdrawal. I would rather take the risk of having some overdose and needing to decrease the pump or needing to be temporarily intubated or all of it. Like, so that's just a a conversation between us if that situation comes up.
Yeah.
Because I have also had a patient where we had that mismatch. Like, she was withdrawing when she came into the hospital because the pump stopped working, but then what I guessed was the right dose for her was too high, and then she ended up re-intubated in the ICU overnight because... But she was a terminal patient. The mom was like, I really don't want her uncomfortable. She's been uncomfortable for weeks while we were waiting for the surgery. So if that is what it is, that's fine. So but that's
right.
A discussion between us to decide where our tolerance for the risk of overdose versus withdrawal is, because it's not an exact science when we're replacing the pump for a failure.
Right.
To know exactly what's going on, because the pump's not working, so we don't know. So we don't know exactly what's going on. But again, that's uncommon.
Okay.
The most common cause of, so the pump itself fails very rarely.
Mm-hmm.
The most common reason for a pump malfunction is the catheter. So right, he's growing.
Mm-hmm.
So as he's growing, does the catheter get stuck, or little scar tissue, or it gets kink in it, or scoliosis, or like so that's the most common reason to have a pump problem, is that the catheter malfunction. So the first test we do, if we're thinking like the pump was working great and now it's like not working as well, there's a side port in the pump where we can draw fluid directly from the catheter. And so you put a needle, so like normally when we refill a pump, we put the needle in the middle, and we take the medicine out and we put new medicine in. There's another port that you can put a different needle in, and then draw fluid from the catheter. And so the catheter is contiguous with the spinal fluid, so you should be able to draw as much fluid as you need, right? Because you should take the medicine out of the catheter and then whatever spinal fluid. And so if we can't get fluid when we do that, it's like something's funky with the catheter. And that's when I call Dr. O'Neill. I'm like, what would you like to do? Would you like to do more imaging? Would you just like to fix would just like to do a surgery to fix the catheter? Those are kind of the two options. We can do additional imaging to try to figure out where the problem with the catheter is, but I would say 90% of the time Dr. O'Neill is just like, I'll just go in and look at the catheter, and if it's kink, to fix it. So that's like the most common scenario of having a pump malfunction. Again, pump complications are around 15 to 30%, and that's all complications. So post-op infections, catheter malfunctions, pump malfunctions, that's like all of them combined together. So having a post-op infection with just like a superficial cellulitis around the incision is the most common. Okay. And the catheter malfunctions are like under 10%. But just so you know the whole story. And so with draw, you'd see significant muscle tightness, so recurrence of his spasticity. You can sometimes see like anxiety, or like hallucinations, hyperthermia, so fevers, like breathing very quickly, high heart rate, all kind of related to like, oh no, all of a sudden our muscles are not controlled anymore, and so our body's like, blah. And that's another reason to call or come to the hospital, and then we'll figure it out. But a lot of times the withdrawal is a little more subtle than that. Like it's like, oh, we've been increasing, like he looked great right after the pump was placed, and then like 6 months from now, it's like, okay, we keep going up and up and up, and it just doesn't look like, you know what I mean? Like, he doesn't look as good as he did right when the pump was placed, and then it's like, ding, 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 ding. Maybe we should check the catheter, because the catheter can also be just a little bit of, right? It can be just squished behind
a little. It's still getting some, but not. Okay.
So that's this is the story.
And while I'm recording information for Dave, you said he's 75
micrograms
per day.
74.9, same thing. Here we go. The critical alarm will play every 10 minutes. Dr. Session likes to say it sounds like a European ambulance. It's like, we'll play that one. So that one is pretty hard to ignore because it's every 10 minutes. Okay. And that means like the pump is about to run dry, like there's no medicine in the pump, or the pump has like failed, like the mechanism is no longer pumping medicine. So that's an emergency. Come to the hospital. I have never heard a critical alarm go off.
I would come to this one, not just any hospital.
I would if you can.
Is it like me bring him or like call an ambulance?
It depends on what he looks like.
Okay.
Yeah. If he looks fine, then maybe it's not a real, like, something's going on. But most of the time, if there's a critical alarm, he's also going to be in withdrawal, in which case you would call an ambulance.
Yeah.
And again, depending on what it looks like, they would recommend taking him to a closer hospital. Not that they could do anything with the pump, but they could give him like IV medicines and stuff to make him feel better.
Yeah.
And then be transferred here, if that makes sense. And then the non-critical alarm is just a single beep. and it plays every hour, and that means we're at this low reservoir level. So that means we have 2 milliliters of medicine left in the pump, which for him should last several weeks.
Okay.
So like it's urgent, like you need to come in and I need to check it, I need to refill it, but it's not like we need to go to the ER right now.
How long will it take me to figure out that one beep every hour?
So some families it does take.
Did you hear that? I heard that.
It does take a couple days. Sometimes it does take families a little while.
I believe it.
Which is why I'm gonna play it for you guys. Especially for kids that have like pulse oxes or like other things that beep.
Yeah.
The other thing is if the motor stalls for whatever reason. So he gets an MRI. The pump is MRI compatible, but it will stop pumping medicine for the duration of the MRI.
Okay.
Like the pump will stall during the MRI. So when he comes out of the MRI and the pump restarts, it will play that beep will to say like, something happened. And then when I check the logs, I'll see that it stalled because of the MRI. But it doesn't, the pump turns back on afterwards. It just, while it's in the magnet, it's not working. Similarly, if you were to like put a magnet over it, it would stop working. Like if anyone has like a pacemaker magnet or like a, I have had one patient where like the non-critical alarm went off and we couldn't figure out why. It was a tablet, like, because like computers have magnets, and so like that was resting over the pump. Or,
But it would have to be like touching it.
Correct.
It's not like his speech device, which is like 2
No, yeah, it would have to be right over it. So sometimes you can just hear that one time, like after an MRI, or if something with a magnet was too close to it for too long. So if it's just a one-time beep, again, I wouldn't worry too much about it. You can definitely call and we can bring him in and I can run the logs and see if we can figure out why. But it's only if it's continuing.
Now, can you only run the logs when he's nearby?
Correct.
Okay.
Like, I need to be able to, not necessarily touch him with this, but it needs to be over the pump in order to, that's one technology that they haven't done, is remote interrogation of the pumps. So I'm going to.
But you can adjust the medicine.
A nurse would have to, it needs to be hands-on. So I can send a nurse out to your house to adjust the medicine.
Okay.
But someone needs to be hands-on in order to adjust the amount.
Okay.
All right, so we're going to pay the critical alarm first.
Okay.
And that will go every 10 minutes. And that's a medical emergency. I'll play it one more time.
I wonder if I would hear that on your monitor.
So things that this alarm will go on for, the battery's dying. Right, so the pump is about to die. The pump is not pumping medicine for whatever reason. Or it's empty.
Okay.
So like all big deal things. And then the non-critical, again, is less. There's less than 2 milliliters of medicine left in the pump. We are close to the battery running out. And so we need to schedule to appointment that the battery's not like about to die. It's and
That's
then
my the actual.
all right. Well, this is the non-critical. This plays once an hour.
At least it's long.
It's long,
not short.
So it's like different than some other beeps.
Yeah.
But it is
It's not super loud.
not super loud. I'll play one more time.
It's good we got you a nurse. Okay.
So neurosurgery said.
I'm about to show you his incision. So if you don't want to see it, I would pause it right away. Okay. Okay, so that's right here in his abdomen. This is stuff left from cleaning up before the surgery. Here's the puck, or the pump rather, in here. They just cut in there and then slid it in. And then the catheter goes around to the back. I'm not going to roll him over here by myself. Maybe I'll show you later, because I can't do that with one hand. And then I guess these were some sort of sensors or probes that they put under the skin. I didn't know about those. But, so you can feel the pump under his skin. Pretty crazy. Okay, so you're gonna see today is Saturday the 27th, so we're what, 10 days out from surgery, and then the incision's looking pretty good. We still have some bruising, which is normal, but it's healing up. The probe spots are healing up. It looks pretty good. We've been wearing his binder on him. We take it off sometimes when he's on the floor just to give it a break. But it prevents, when he's in his chair, he always wears it. It prevents him from the pump moving around and to try to keep the air pockets from forming. I forget what they're called. I should look that up. But he's doing pretty good. He's starting. His appetite is back. We took him off the painkillers, and so I think we're on this upswing here. He's tolerating his being in his chair longer. So we just wrap this around. It's an abdominal binder. It's just hard to do with one hand. Then we wrap it up this way, and it velcros. So yeah, I think I'm gonna end the video here, and then maybe I'll do another one after our follow-up with we have a follow-up with the rehab doctor and a follow-up with neurosurgery. So maybe I'll do a video, because this video is pretty long, I think, by this point. So overall, it's going well. I mean, we had a couple days where he wasn't wanting to eat much, and we were worried about that. But his appetite seems to be back, and he's doing better in his chair. So as far as painkillers that I mentioned in the last part, he was just on Tylenol and Motrin back and forth for a couple of days here at home. So it's been quite the experience, and at his next visit, we'll probably increase the Baclofen, and she'll do that with her computer thing and the remote above his pump. And because he was looser in the hospital, like his arms and legs. His wrists and ankles are better, still good right now, better than they were before surgery. But I would say his legs and his arms are still a little bit tight. So they will take it a step up at the doctor's visit. But overall, it's going well. We're excited to see what it will do for him. And I'm hoping to start some PT, some physical therapy and occupational therapy, perhaps start building up some of those muscles and see if he can do more. So thanks for watching. I hope you learned some things. If you have any questions, please comment. And I'll do what I can to answer them. So that was our experience, right, buddy? I think the abdominal binder really helped hold it all in there and make it not so that there wasn't as much pressure on everything. So it's important to get the abdominal binder, and if they're not going to give it to you, you should ask for it after surgery. So, all right, so thanks for watching. God made you on purpose, and you're important, and he loves you. So share your smile with others, and have a good day. Thanks for watching.